So how do you treat bladder irritation? As a women's health physical therapist, my job is to educate people on better health tips, habits, things that you can consume and do to control your symptoms on your own. Now, my patients that will come to me with bladder dysfunctions have seen a urologist or a urogynecologist. Sometimes my patients come in with a diagnosis of interstitial cystitis, sometimes overactive bladder. Lately, there is the new term of COVID-associated cystitis. All of these things involve the lining of the bladder mucosa being spicy. And we know in research with IC that the number one pain reliever for an irritated bladder is mindfulness and meditation. Because if you can learn how to regulate your mind and your nervous system, you can learn to regulate the pain. Now, that is not to say your pain in your bladder is not real or that your bladder mucosa is not irritated. No, it is. I am all in the business of control, reducing pain. And so one of the first things I always tell my patients is never underestimate the power of meditation and mindfulness, 15 minutes a day, lying down, doing whatever it takes to breathe and calm that nervous system. I always have my patients as well during that time to use a heating pad on their abdomen. Other things that I do vary based on what a person's diagnosis is. If a person has interstitial cystitis and has been diagnosed, I will talk to them about avoiding irritants. I give them information to the International Cystitis website. If I think that their symptoms are significant, I refer them to a dietitian to talk about bladder irritation reduction through changing their diet and supplements. But another thing that people can do to help an irritated bladder is to stay hydrated. Avoid caffeine, avoid alcohol, avoid irritants. It also seems to me no matter what is wrong with the bladder, preservatives never roll well with bladders. Other things I talk to my patients about is what are you doing to get blood flow to that area? If we need to get improved vascularity to the pelvis, the number one way, other than your heating pad, is to walk as you can tolerate, because walking increases vascularity, increases healing, and can help your bladder heal. These are very general things, but seem to work consistently across the board with grumpy bladders.